So hi, welcome to pathology. So here in pathology, me and the team are working as biomedical scientists. So our job is to run blood tests. The doctors and the nurses, phlebotomists at the hospitals and the GP practices will collect the blood and order the tests, and they'll come to us and we'll do the tests and report the results. So the blood tubes will arrive in the lab, and then my job as a biomedical scientist is to run the equipment. And here I have a rack of patient samples. To run the tests on the equipment. So my job as a biomedical scientist, or BMS, is to maintain and operate the equipment, make sure it's working correctly. That involves cleaning, troubleshooting, documentation. And then we review the results. So we know what normal results are, reference ranges. If it's particularly abnormal, we might do further tests. In hematology, I can show you the microscope. So here I can make a blood film and sit at the microscope and look at the red cells, the white cells, the platelets on the microscope. And that will give us more information that we can report back to the doctor to help with patients' diagnosis and disease monitoring. So for example, if I'm a patient at the Beacon Centre at Musgrave Park Hospital in Taunton, I might be on chemo because I'm a cancer patient. So one of the tests they do is to do a full blood count. Unfortunately, one of the side effects of chemotherapy is to reduce your cell counts. So we can monitor this on these machines, and I can report the results back to the doctor, who can then change treatment or take other actions to help the patients. So what I really like about being a BMS is I'm helping the doctors and I'm helping patients. And I get to work as a BMS in the lab. So what I really liked when I was at A-levels in university, a science degree. So I did my science A-levels, and then I went to university and did my biomedical sciences degree. So that was really enjoyable anyway. And it gives you lots of options, but one of those is to do a biomedical sciences degree, which is the qualifications you need to be a BMS. The staff that we start here as trainees, they have the degree, and then we provide training on the job, and they do something called a registration portfolio, which is the second part of their qualifications that they need to become a BMS. So they train on the job, work as trainees under the supervision of the BMSs. We provide lots of training and they learn on the role, and then after a year or so they can become BMSs, and they can do the rest of the tasks like reporting the results and doing the microscopy.
So I'm making some blood films for morphology, so we could have a look at the red cells. We need to give the samples a really good mix before we make the blood films. Just using some glass slides here. And we use a wooden stick, and we just check the sample to see if there's a clot inside before the film's made. That's fine. And just put a drop on the slide. And then use the other slide to spread the film. And then we label it with the patient details. Okay, and then we leave this to dry. And once it's dried, it goes on the staining machine. And then we have a look at it on the microscope.
Yeah, so cytology and andrology are quite specific subjects. Cytology historically was divided into gynae cytology and non-gynae cytology. And the non-gynae cytology is specifically diagnostic cytology, and we process samples from patients from all over parts of the body, and we prepare the slides for the pathologist, and they can diagnose sometimes from cytology the patient's disease. Andrology, on the other hand, is mainly semen analysis, and that's a very specific area of pathology as well. That concentrates on male fertility samples and post-vasectomy, semen analysis.
Absolutely. Well, this is the bacteriology laboratory. What we're involved with is growing bacteria from wound swabs, urines, stool samples, all that glamorous work, blood samples, so like blood culture work. And what we do is we grow the bacteria. We then perform tests to identify the bacteria and confirm what we've grown, and then we do sensitivity testing. So that involves finding out what antibiotics we can treat the bacteria with. And then we'll report those results to the clinicians so they can start treating the patients. We start out with a trainee biomedical scientist, so for that you would do a biomedical sciences degree. You do the portfolio work, and then you start out as a band 5 BMS. And in that role you'd be reading plates, so that'd be bench work, performing all the tests. And then from there you progress on to a band 6 BMS, so then you're making more decisions about interpretive results, validating results that go out to the doctors. And those are the roles. And from there we go on to be team managers. And beyond there it just gets quite high management levels. So those are the roles we have. I think we're looking for people that have a very good attention to detail, because what we're looking for when we're identifying bacteria is finding out which ones are the pathogenic ones. Because if you get a skin swab, it's absolutely covered in bacteria, and what we want to know is which ones are causing the problem. So yeah, attention to detail is a very good trait to have. Great teamwork as well. At the minute, as you can imagine, in a pandemic, we're under quite a lot of pressure. We need people to be flexible as well, so moving around, willing to step in, sometimes quite last minute to cover shifts. Yeah, I think teamwork is probably the most key skill, I would say.
Yeah, so basically South West Pathology Services has a number of roles that go all the way from medical laboratory assistants, which is support work, all the way up to senior management, and that goes from band 2 to band 8. And that South West Pathology Services, to cover all of these bands, is trying to grow this culture of growing our own staff. So with this culture of growing our own staff, we support a lot of training. As it was mentioned before, if you're going on a biomedical sciences career pathway, there's loads of opportunities to train and develop their skills, including apprenticeships, training opportunities with IBMS portfolios, with registration and specialist portfolios. We offer placements for apprenticeships for T-level qualifications at the moment as well. And we offer apprenticeships for members of staff that we have in-house, that they don't have a biomedical science background, but they want to pursue their career in that direction.